You know, I'm not saying, again, the president lied about this, but I think Governor Bobby Jindal did. Take a look.
If he hadn't looked the American people in the face and promised them he was going to let them keep their plans, keep their doctors, cut their premiums, there's no way this would have passed.
All right, Mattie Duppler, Americans for Tax Reform, thinks the governor is right. So you think he lied, Mattie?
Well, don't put words in my mouth, Neil. I'll be a little more generous than that. But you're right. You just had about what these numbers actually mean has been extraordinarily misleading. And, you know, the governor really hits at the right point here. The president keeps talking about the amount of people who have gained health insurance under this law, and that, of course, is what the controversy is that we're talking about today. But the bigger question is how many people have health care under this law. Under Obamacare, we've got providers who are dropping out of networks who can't live up to these mandates that the law has set, and people, whether they're in the exchange or still with private insurance that they got outside the exchange, are going to see their health care providers bleeding out of the system and being unable to get the care that they need.
So when push comes to shove, and they're shoving numbers of this magnitude that have enrolled and that the trend is their friend, you say what?
Well, I think that the point you made earlier is an important one. The first is that CBO has told us all along that at the 10-year period out from this law, we're still going to have around 30 million people who are uninsured. So the question for the proponents of Obamacare is whether or not this law is sufficient to say that we have fixed the health care problems in the United States. And I would suggest it's not. 30 million people is far too many people to have unemployed for a law that was supposed to be a comprehensive health care reform bill. And look at what the costs that come along with it. You've got 6 million people who are kicked off of their insurance plans and are now probably buying in an exchange that is more expensive and has less coverage. Not to mention the tax increases that have already gone into effect, 20 new or higher taxes in Obamacare, and we still have many more increases coming down the road. So the threat to families, employers, the American economy is huge, all for the sake, as you said, for maybe 1 million net new enrollees in health care.
All right. It's a mess, and it's a numbing mess, but we'll see. Mattie, as always, thank you.